Today we're going to be practicing palpations on the knee and the patellofemoral joint. These palpations will be from the medial, the lateral, and the anterior aspect.
Okay, we're going to be doing the joint line and meniscal windows. So we're going to have the patient laying supine with their knees slightly flexed. We're going to have your hands, your proximal posterior lower leg, you're going to grab your fingers underneath there. And you're going to find a patella tendon and place both thumbs there. You're going to palpate the patella tendon, and then right here are going to be your meniscal windows. And then you're going to find a depression and follow it medially and laterally for the joint line. Just right there. Okay, so we're going to be doing the medial tibial plateau. So we're going to have the patient laying supine again with their knees flexed. We're going to have us grasp the lower leg with the fingers in the popliteal. And then we're going to put our thumbs right here where the depression is at of the joint line. And if you press inferiorly, you're going to see the medial tibial plateau right here. So this depression line right here, and then move inferiorly, and that's going to be the medial tibial plateau right here. Okay, so now we're going to be doing the tibial tubercle. So if you first you're going to find the infrapatellar tendon. So if you follow this distally, it's going to lead you to a little bony prominence right here, and this is going to be the tibial tubercle. That's where it inserts. It's also the insertion of the pes azerine. So first you get the infrapatellar tendon, you follow it, and then right here you can see a little sticking out. This bony prominence is the tibial tubercle. So right now we're going to palpate the medial femoral condyle. We're going to have patient laying supine with knees flexed at 90. So you're going to find your meniscus windows right here. Right here you're going to put your thumbs on your meniscus windows, and then you're going to follow the joint line depression. And then right here is where you're going to find your medial femoral condyle, following the depression. So you start here, you follow the depression, and this bony prominence medially is going to be the medial femoral condyle. And then if you move more medially, you're going to feel a sharp edge, and that sharp edge is going to be where your medial femoral epicondyle is at, right here. Okay, so now we're going to be doing the adductor tubercle. So you're going to start with your medial femoral condyle, so it's going to be right here. And then you're going to move medially and posteriorly until you feel a natural depression. And that natural depression is going to be between your vastus medialis and your hamstring muscle. Right next to it is going to be a little bony prominence where it's going to be your adductor tubercle. So you wait to your natural depression, and right there is going to be a little bony prominence. And that's your adductor tubercle. Okay, so we're going to have the patient sitting down with the legs off the table to palpate the medial meniscus. So we're going to start off at the medial joint line, and then we're going to have the patient internally rotate the tibia. And what that's going to do is going to make the meniscus poke out a little bit, and that you're going to palpate a soft prominence and that's going to be the meniscus right there. So you start off at the medial joint line, have the person internally rotate, and then that's going to make it pop out right there.
In this last video, we just palpated the medial meniscus. In the video, we palpated both the lateral and the medial side, but for the purpose of palpations, you would just palpate the medial side, which is the side closest to the midline.
Okay, so now we're going to do the medial collateral ligament. This is a fan-like band that connects the epicondyle to the tibia. It also is the medial meniscus. It's also connected to this. So to palpate this, you're going to find the medial joint line, and then the meniscus windows are going to be right here. You're going to find a medial joint line. And you're going to move medially and posteriorly along the joint line. It should be the region of the MCL that will become very tender. So right here. It's not easily palpable, but whenever you have a sprain, it'll become very tender. So you just move along the joint line medially and posteriorly. So now we're going to be doing the pes azerine palpation. So we're going to have the patient sitting over the edge of the table. And I'm going to do is I'm going to stabilize the leg, and then I'm going to palpate the tibial tubercle. So tibial tubercle is going to be right here. I'm then going to move slightly medially and posteriorly. And then I'm going to have the patient flex with my resistance. And this is going to make these tendons more prominent while doing this. And it's going to be the pes azerine right there. So they're just going to be more prominent. And then underneath that tendon is going to be the pes azerine bursa.
Okay, so the next palpation that we're going to be doing is going to be on the lateral side. The first palpation is going to be the lateral tibial plateau. So for this palpation, you're going to have your patient supine with the leg bent at the knee joint. You're going to grasp the lower leg from the front with your fingers in the popliteal. And the thumbs are going to be in the depression, so the meniscal windows here, of the joint line. And if you press inferiorly, so if you press a little bit downwards, down, you'll feel the tibial plateau on the lateral side. You can also feel the medial tibial plateau on the medial side. We're looking for the lateral here. So that's just going to be this little depression, and you can kind of feel that tibia kind of going straight off into the joint. The next lateral palpation we're going to be doing is the lateral tubercle. So this is going to be a large prominence of bone below the lateral tibial plateau. So as we did before, the lateral tibial plateau is going to be this drop-off that you feel here, inferiorly to the depression, the meniscal window. But to palpate the lateral tubercle, you're going to go straight from the patella tendon. So here's his patella. His tendon goes down here. So from the patella tendon, you're going to go laterally. So you're just going to move out, and you'll feel this little bony prominence. That's going to be your lateral tubercle. Okay, so the next palpation we're going to be doing is the lateral femoral condyle. To start this palpation, I'm actually going to move his knee into flexion, because we're going to need to flex the leg or the knee past 90 degrees, and I'm also going to be tracking his patella here. So as we flex the knee past 90, his patella is still here. So to be able to locate the lateral femoral condyle, we're going to palpate a smooth surface that is right below and lateral to the patella. So you're going to feel this round and smooth surface on the lateral side. Okay, and then to palpate the lateral femoral epicondyle, this will lie laterally to the condyle, and it'll be right there. So you have your condyle and your epicondyle. Okay, the next palpation is going to be the lateral meniscus. This is easiest to palpate when the patient's knee is flexed, as he is here, and you will go into this meniscal window, and you're going to probe firmly in the lateral joint space. So you're going to move your thumb there firmly, and you may be able to feel the anterior margin of the lateral meniscus. Next palpation we're going to be doing is the lateral collateral ligament. So this is best to palpate when the knee is flexed to 90 and the hip is abducted and internally rotated. Now this kind of looks like you have your leg crossed over as if you were sitting. So what you are going to do is find your fibular head, so it should be even with the tibial tuberosity or tubercle. So fibular head. And you're going to find a thick cord-like structure that runs from the lateral epicondyle to the fibular head. So you'll feel this sort of thick band in here as you palpate over it. For this palpation, we're going to be doing the biceps femoris tendon. So your biceps femoris is actually one of your hamstring muscles that runs laterally back this way. But to palpate the tendon, you're going to have your patient with their knee flexed at 90, and then you're going to grasp down on the lower leg because you're going to be instructing the patient to resist flexion as soon as you find the fibular head, which is going to be this bony prominence right here. So as soon as you have your hand on the fibular head, you're going to ask the patient to flex their knee, and you're going to resist their flexion, and you can feel the tendon run from back to front into this fibular head where it inserts into the fibular head. So it moves down the lateral side of the knee and comes down and inserts onto this fibular head. The next palpation is going to be of the iliotibial tract, or the IT band. This is going to be on the anterior lateral side of the knee. So there's two ways to palpate this. We're going to do this way first, which is going to be having the patient with their leg fully extended. So he has his leg fully extended. And as you can see, the IT band is actually more visible this way. So it's a little more prominent. So you see it poking out on this side. And right here, you're going to see that it's going to insert at this lateral tibial tubercle. So it's a lot more visible when you have the knee fully extended. And the second way to palpate the IT band is to have the patient seated. So he's seated, and you're going to have them dig their heel into the ground like they're squishing a bug. So if you can dig your heel in, you can see that the IT band is moving in this space. So if you keep moving, it gets more prominent. And you'll see that movement around that lateral tubercle like we did for the extended palpation. Okay, and the last palpation for the lateral palpations of the knee is the common peroneal nerve. So this nerve actually runs alongside the biceps femoris, so we're going to do the same palpations as we did for biceps femoris. So we're going to have knee to 90, and I'm going to have my hand at the posterior aspect of the lower leg, and I'm going to ask the patient to flex their knee against my resistance. And you can see the biceps femoris tightening up here in the back. I'm going to follow that to the fibular head, and across the neck of the fibular head will be the common peroneal nerve. Okay, so last but not least, we have our anterior palpations. We're going to start with the patella. So the patella is the large sesamoid bone that glides over the knee joint. So as you flex and extend the knee, you can see it kind of moving. So this is going to be the superior aspect, or pole, and it actually moves down to the apex. So it kind of looks like a triangle in that sense. This is commonly called the kneecap. Okay. So for the patella tendon, we can start on the inferior pole of the patella, which is down here. So we started here. This is the apex, or the inferior pole. And this band, it's very rough or very tight, and you can feel it. So this will run from the pole, the posterior pole or inferior pole of the patella, and it'll insert on the bony prominence right here that we talked about in the medial palpations, which is the tibial tubercle. So it'll be a bony prominence, and this is where the patella tendon inserts. Okay, and in order to palpate the trochlear groove, you're going to have your patient relax and making sure that the quads relax so that it's not pulling on the tendon. And you're going to move your patella to the side, medially and laterally, and underneath you can feel the trochlear groove down here, and this is where the patella glides on. So you can feel it. Okay, and the quadriceps tendon is going to run from the end of the quadriceps muscle to the superior pole of the patella. So this is going to be the superior pole. It's going to be the top of the patella. Your quadriceps muscle, or your rectus femoris, will end about here, and all through here is the tendon, so it'll run in between your vastus medialis, which is here, and your vastus lateralis, which is here. So it'll run from here to the superior pole.